it's CJ. Welcome to week 41 of your pregnancy. You are now what is considered late term, and hopefully that baby is going to arrive any day now. Today I'm going to talk about what's happening with that tiny human, some of the more common symptoms that you might be having, what symptoms you need to be on the lookout for. And if you stick around, I will explain what to expect if you are scheduled for either a non-stress test or a biophysical profile. At 41 weeks, your baby is now measuring right around 20.5 inches or 52 centimeters from the tops of their heads to the bottom of their feet. And they weigh between 3 and 4 kilos, that's 6.5 to 8.5 pounds. Keep in mind, some babies are going to be bigger than that, and some might be slightly smaller. Your baby at 41 weeks is the size of a pumpkin. Developmentally, that little one is completely ready for life outside of your uterus. The vernix that was once covering their skin is now gone, so if you give birth this week, you may notice that your baby's skin is peeling and appears somewhat dry. That baby should be every bit as active as he or she normally is. As far as your symptoms go, here are the 5 most common ones. Number 1, anxiety. You might be wondering if that baby is ever going to get here. Number 2, constant heartburn. After all, those stomach acids have nowhere to go but up. Number 3, frequent urination. After all, you've got a 6 to 8 pound baby pushing on your bladder. Number 4, and this goes without saying, pelvic and lower back pain. And number 5, again, fetal movement. Once you get to 41 weeks, the placenta might not be working as well as it normally does, so it's really, really important that you pay attention to your baby's fetal movement. That being said, here are the symptoms that you need to be on the lookout for. Signs of labor, contractions that are so strong you can't talk through them. If your water breaks, if you're bleeding heavy enough to saturate a pad in an hour, or again, if your baby isn't moving like they normally do. Any signs of preeclampsia, the worst headache of your life. Changes in your vision, black spots, flashing lights, tunnel vision. A sudden onset of severe swelling, or if you are having a burning sensation in your liver. Remember, your liver is located in the upper right-hand side of your abdomen, behind and below your right breast. And finally, let's talk about the monitoring that's going to be recommended now that you're in your 41st week. You might be scheduled for a non-stress test. That is a simple test that's done either in the hospital or clinic setting. You may lay on a bed, or you may be in a lounge chair. The test typically takes about 20 to 30 minutes. They're going to put 2 straps on your belly. One's going to monitor uterine contractions, the other the baby's heart rate. The best thing to do before a non-stress test is make sure you drink plenty of water and eat a good snack. The second test is a biophysical profile. That is an ultrasound that looks for 4 different things. Your baby's heart rate, the amount of fluid surrounding your little one, breathing motions, and muscle tone. Or you may be scheduled for what's called a modified biophysical profile. That is where they do a non-stress test, and then they do an ultrasound to check for the fluid surrounding your baby. I do hope that this information has been helpful, and that if you have questions, you'll leave those for me in the comment section below. Oh, and while you're in that comment section, I sure would appreciate it if you'd hit the like button, or feel free to share this video. Hello, it's CJ. Thank you so much for watching the entire video. I truly do hope that the information has been helpful. When I make these videos, it is not meant to replace a visit with your healthcare provider. Rather, my hope is after watching my video, you know what questions to ask your provider at your next visit to best meet your own healthcare needs. In the meantime, if there's any questions that I can answer, I hope you'll reach out to me. And finally, if you have not already subscribed to my channel, I'd really appreciate it if you did that. That's all I have for today. This is CJ, and I am at your cervix.